Welcome to Blocking the Fame, Anakinra and COVID. I'm your host Gaganasri, and this is episode 7 Timing is Everything. Early versus late use of Anakinra in COVID 19. In our previous episodes, we delved into the molecular mechanics of Anakinra and how it can target the hyperinflammatory state in COVID 19, like a fire extinguisher rousing an uncontrollable blaze. Today, we are tackling a critical question. When exactly should we deploy Anakinra for maximum effect? Should we intervene early, or is it only beneficial once inflammation has escalated? To help us break this down, I'm joined again by Aseema, a microbiology researcher with a keen interest in immune responses and therapeutic interventions. Aseema, it's a pleasure to have you back.
Thank you so much, Gaganasri. I'm really glad to be back. And I'm super excited to dive into the timing aspect of Anakindra's use in this episode. It's like having the right moment to strike with a precise tool, and timing really can make or break the outcome.
Absolutely. So let's set the stage. What happens during COVID 19 that makes timing such an important factor in treatment?
Well, COVID 19 can be thought of as a two-phase storm, if I can put it that way. The first phase is viral replication, where the virus spreads across the body. But as the storm builds up, the immune response intensifies. In some patients, it even turns into an overactive storm, like hyperinflammation, that wreaks havoc on the vital organs, particularly the lungs, kidneys, and heart. And if we wait too long when the damage is already extensive, recovery becomes a distant hope. But if we intervene early, we can prevent the storm from escalating into a full blown disaster, if you know what I mean.
Yeah. So when we're talking about early versus late use of Anakinra, what exactly are we referring to in terms of timing?
Oh, great question. So, early use means administering anakinra when the patient shows early signs of inflammation, indicated by elevated markers like CRP, ferritin, or suPAR levels, before significant damage has occurred. While late use refers to treatment after the patient has entered the severe stages such as respiratory distress or even multi organ dysfunction.
So in terms of effectiveness, does Anakinra show better results when used early in the disease course?
Yes, so the clinical data strongly suggests early intervention in anakinra leads to better outcomes, particularly in patients with moderate COVID 19 and rising inflammatory markers. Think of it like catching a fire before it spreads. It's much easier to put out the flames early, right? Preventing damage to the structure.
Okay. But then what happens when Anakinra is used later, when severe symptoms have already set in?
Late stage intervention, when the organs are already damaged, yields kind of mixed results, is what we have observed. Anakinra still provides anti inflammatory benefits, but its ability to halt further damage is limited once the body's systems are in crisis. For example, patients who are on mechanical ventilation or are experiencing sepsis may not experience the same level of recovery as those who were treated early. And that said, some trials have shown modest benefits when it was used later, but the results are not as striking.
Okay. Have there been any clinical trials that specifically examine the timing of Anakinra's administration when administered early or when administered late?
Yes, so there have been several trials that looked at the timing factor. For example, Save Mode trial, like we spoke about before, showed that anakinra was more effective when given early to patients with elevated suPAR levels. While other studies have suggested that early administration reduces mortality rates and the need for mechanical ventilation as well. However, when anakinra was administered late after the patient has progressed to ARDS or severe respiratory failure, the benefits were comparatively less.
So it seems like early intervention is the key. But could there be any risks in administrating it too soon, or are there any downsides to it?
Well, the risk of early treatment is generally low. Anakinra has a solid safety profile, especially since it has been used for long-term treatment of autoinflammatory diseases. However, patient selection is really crucial here. If you administer Anakinra to a patient who does not have significant inflammation or is not at risk of a severe disease, it might not be effective. Additionally, there's a potential concern that early immune suppression could interfere with the body's ability to fight the virus itself, although this has not been a significant issue in the trials that we have seen.
And what about using Anakinra in combination with other treatments? Would the timing of these treatments also influence the outcome?
Yeah, absolutely. So Anakinra works synergistically with the other standard therapies like steroids, which modulate the immune system, or on a broader scale. And the timing of steroid therapy is just as important. When both therapies are initiated early, Anakinra specifically targets IL-1, while steroids provide a wider anti-inflammatory effect. And if Anakinra is used too late and the steroids have already managed much of the inflammation, then the additional benefit from Anakinra might not be as pronounced. So the key is to time both treatments to work in harmony as early as possible.
So in summary, I think timing is absolutely critical when it comes to Anakinra. What do you say?
Yes, absolutely. Timing is really essential. The earlier anakinra is administered to target the systemic inflammation, the better will be the outcomes, particularly when it comes to reducing organ damage and improving survival. But it's all about choosing the right patient and the right moment in the disease progression.
Thank you so much, Aseema, for sharing such valuable insights on how timing plays a pivotal role in Anakindra's success. That wraps up today's episode, where we have explored how timing of Anakinra administration, whether early or late, can significantly impact its effectiveness in controlling inflammation in COVID-19. Timing isn't just a clinical decision; it is an immunological strategy. In our next episode, we'll take this a bit further by discussing how can we use biological markers like CRP, ferritin, and suPAR to guide the timing of Anakinra. As always, this podcast is for educational purposes only, and it's not meant for medical advice. If you have any medical concerns, please consult a licensed healthcare professional. Thanks for tuning in, Blocking to the Flame, Anakinra and COVID. See you in the next episode.